Yep.
Yes.
So I will talk briefly about what we are calling the federal government's strategy to spread the new coronavirus in Brazil. And after that, I think we can debate a little bit and I can answer some questions you might have about the situation in our country. First, it's important to make an introduction about the Brazilian health system and some historic backgrounds, because this is important to understand why is so bad what we've seen in Brazil once we have a public universal health system. So after 1988, with the democratization of the in Brazil, the Brazilian health system has been profoundly changed. Health, since then, is considered as a constitutional human right recognized by the Constitution. There are 5 articles treating exclusively about health rights in our Constitution. The Constitution stipulates universal and equal access for health public services, and since 1988, the access for public health services in Brazil is free for everybody, regardless of socioeconomic condition of the user. It's very different from US system, for example. We have no, it's more alike the Canadian system. But in Brazil, uh, we have also access to pharmaceutical services and in the public health system, what Canada doesn't have. So Brazilian health system is very humanistic and, and has in itself a solidarity meaning for our country. So there is no more need for contributions, and anyone can access public health services, including pharmaceuticals. This is the article which recognize health as a human right in Brazil. So health is a right of all Brazilians and is a Brazilian state duty, guaranteed by social and economic policies aiming at reducing the risks of diseases and other health problems and at assuring an universal and equal access to health actions and services. With this article in the Constitution, since 1988, Brazil has been developing his public health system in a very interesting way. We have all municipalities in Brazil. We have 5,570 municipalities. Each one of them has its own public service related to their capacity to offer health services, but all them will treat what we call basic services in health or primary health care. So this is a very important movement we've made in Brazil to create a public health system able to support all Brazilians regarding health needs. So these have been evolving since then. Now we have the Brazilian Unified National Health System. It's called SUS. Here you can see the logo mark from the Brazilian Unified Health System. It's not linked to any need of payment, totally financed by public budget. And this, the Constitution will conceptualize the public health system as the public health services integrate a regionalized and hierarchical network, and constitute a national unified system. So we have inside the Brazilian Unified National Health System, uh, public services offered from municipalities, public services offered from state members. We have 27 state members, and the public services offered by the federal government. All that will compose this public health system in Brazil in an integrated and regionalized way. So this is a very intelligent system we've created in our constitution. It has been evolving very well since then, but after 2014, with the economic crisis, and especially after 2016, when we had the impeachment of the former president Dilma Rousseff, and the president Michel Temer, and now President Jair Bolsonaro, they've been deteriorating the public health system in Brazil, not financing the system with the public budget they should, and not putting to manage the public system people with ability to do so. So our Ministry of Health, until yesterday, was a military who confessed he didn't even know about the public health system before becoming a minister. So since 2014, and especially after 2016, the public health system has been deteriorating a lot. And now I'm going to talk specifically about the federal government herd immunity strategy. So what we've discovered with our research, we've made a research where we collected all federal rules and state members' rules regarding the response of the Brazilian state against COVID-19. And we have gathered more than 3,000 federal rules treating how the federal government will attack COVID-19. And when we analyzed all these rules, we've seen that under the leadership of President Jair Bolsonaro, the federal government in Brazil has failed to implement a systematic plan to prevent the spread of COVID-19. Instead, under the practice of shortening the public health crisis and protecting the economy, the Brazilian government has pursued a herd immunity strategy. What means what they want in the federal government is that 170 million Brazilians get infected. And when more than 170 million Brazilians get infected, we will have what we call herd immunity or collective immunity. And with that, we will end the pandemic in our country. The problem in this kind of mathematics is we have now in Brazil 13 million infected people and 300,000 deaths. If we make a simple count, to achieve the herd immunity in Brazil, we will have to handle almost 6 million deaths. So this is what the federal government is trying to make in Brazil. And we cannot allow it to happen because 300 deaths is already too much, and 6 million deaths, it's a genocide. So this is why we are making these results even partially public, not only in Brazil, but in UN, in the Penal International Tribune, in the American States Organization, to try to stop this strategy and the mortality we've been having in Brazil. So we led this study. We gathered and analyzed laws, judicial decisions, speeches, and public statements by federal officials. And we found that these records suggest that the government pursued a three-pronged approach to achieving herd immunity through widespread contagion of the public. So the first prong is that the president signed a lot of rules, decrees and resolutions and so on, defining, for example, religious services, construction industry, beauty salons, barber shops, gyms as essential services, so they could remain open even under lockdowns in Brazil. So with that, we will not have, as we did not have until now, any lockdown that we can call as that. We have what I've been calling the Brazilian lockdown. It's a lockdown uh, only in formal rules, but in practice is a lockdown where this kind of services can open. So with that, almost nobody will remain in their houses. Also, the president vetoed a series of legislative measures to limit the spread of COVID-19, such as uh, he vetoed the mandated use of fake face masks in prisons, and we've been having a lot of deaths and infections in prisons in Brazil. He vetoed the requirement that businesses which stay open during the pandemic supply employees with free personal protective equipment. This is so basic, but it's impressive. He vetoed that. So in Brazil, the employees does not have the right to have from their employers the protective equipment against COVID-19, such as masks, alcohol, and so on. He also vetoed the mandated use of masks in closed spaces. This was rejected on the grounds that it would encroach on the right to privacy in one's home. So but we were talking about commercial establishments, public services, public environments, and he told that if it was private, the Brazilian state could not obligate any private commerce or service to obligate their employers or customers to use masks. So it's incredible, but he did that. And now we do not have a national rule obligating people to use masks in public spaces. And he also vetoed the protections for indigenous communities, including the provision of drinking water, hygiene and cleaning products, hospital and ICU beds. So with that, he is promoting an indigenous genocide in Brazil. A lot of indigenous people are dying, and the pandemic is out of control in many indigenous communities, especially in Amazon. The president has also put in place what I call a free coronavirus policy. What is it? He excluded various occupations from an emergency financial aid program, effectively forcing people to keep working during the pandemic, while he also blocked the Congress's proposals regarding financial reparations to families who lost members on the front lines of pandemic healthcare. So with that, he obligated a lot of people, especially the poorest, uh, uh, to go out and fight for surviving. And people went out, and with that, the pandemic ran out of control in our country. So he did not give to people the financial aid they should have to remain at their houses. So they started to have hunger, and with that they went to streets, and economic measures were not sufficient to keep people at their houses. It was very alike the US policy while Donald Trump was the president in US. He copied a lot of Trump's policies. And these are just some of the measures that he vetoed regarding financial aid. Secondly, uh, he obstructed states and municipalities' efforts to try to handle the pandemic in their territories. State and municipal government responses to the pandemic have been systematically obstructed by the federal government and especially by the president. He himself defined this as his war against government leaders who adopted disease containment measures. And he is in this war until now. Yesterday, he was calling governors who decreed lockdowns, a lot of bad names. So a few of examples of these are the unjustifiable delay of emergency funds to states and municipalities. He blocked the funding transfers to states and municipalities to fight against the pandemics. Uh, the use of only a small portion of the pandemic response funds allocated by Congress, and through the Ministry of Health, the systematic mismanagement of purchases and distribution of fundamental items like diagnostic tests, personal protective equipment, respirators, oxygen, vaccines, and syringes. So with that, and this is all in decrees, resolutions, formal documents we have had access with our researchers. It's not only political speech, it's an state policy from the federal government obstructing the efforts from states and municipalities in Brazil. The federal government also has made propaganda against public health. Despite tremendous pressure from businessmen and politicians, state and local governments have managed to avoid the collapse of Brazil's national public health care system, with shocking exceptions like the city of Manaus, where we have had a tremendous tragedy and deaths that we cannot even count in a exact way. But now the system is not being able anymore to support this pressure. And Brazilian public health system, like Vitor had said in the beginning, is collapsing. Uh, he also, the president and the federal government, has been a barrage of propaganda against public health. This has taken the form of political discourse that employs economic, ideological, and moral arguments and disseminates disinformation and scientifically unverified information with the purposes of discrediting health authorities, weakening public adherence to science-based recommendations, and encouraging political activism against the public health measures needed to contain COVID-19. The president himself, in the beginning of the pandemic, he told to his supporters to invade hospitals to see if the ICUs were uh, really in collapse or full of people. So he put in people's minds the doubt that the pandemic is serious, the doubt that the public system is collapsing, the doubt that we are facing the number of deaths we are facing, even though the numbers are from the Ministry of Health. So he has a very tragic game in and political game, uh, putting people against the idea of public health and respect for public health. And this we are collecting the price of it with a lot of deaths. The president has not only held crowded public gatherings and traveled extensively around the country to preside over ceremonies like ribbon cuttings, but he has also systematically pushed the public toward contagions, uh, saying things like that. You will all catch it someday. What are you afraid of? Face up to it. There is no use trying to escape from COVID. Escape reality. We have to quit being a country of sissies. So with that, this is also homophobic, but with that, he pushes people to confront public authorities, health public authorities. We have some people do not use masks because using mask is a political statement. If I do not use mask, I support the president. If I use mask, I am a leftist, I am a communist, or things like that. So he had built this wrong idea regarding what is correct to do regarding public health measures we need to make, and this is very serious, and this made the Brazilian uh, reality regarding pandemic, the tragedy we are seeing. Furthermore, he has pitted health against the economy. He incited supporters to invade hospitals to show that reports about overcrowded hospitals and the shortage of respirators were allegedly fake news. He has tried to discredit vaccines, claiming that they cause death and disabilities, and saying that if you turn into a crocodile taking the vaccine, it's your problem. He also told that whoever take the vaccine, we will have uh, 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 his voice will be transformed to a women's voice, you know. So he's systematically talking this kind of things to put people against public health measures, and he is winning this propaganda fight. He has also attempted to convince the public that this disease is vanishing. In December, when the curve of deaths and infections in Brazil was raising, he told that we are now at the tail of the end of the pandemic. Yesterday, Brazil had 3,000 deaths. So we can see that he lies and lies and lies, and he keeps going like that. His recommendation in the early stages of the pandemic that people use ineffective medicines such as hydroxychloroquine is an important element of this propaganda campaign. This recommendation was issued by the health ministry, but not before two ministers were fired, not one. One was fired and the other one told he stepped down. But actually he was fired because if he did not introduce hydroxychloroquine in our public health system as a treatment for COVID-19, and we know with evidences that it is not, the ministry would be fired. So the Minister of Health decided to jump out before he was fired. We are now in our fourth Minister of Health during the pandemic. Four Ministers of Health in 1 year. This long-standing, well-funded ministry had an exceptional technical staff that had weathered transitions of power for decades, but was until yesterday headed by a general, while more than 20 key posts were held by military officers, most of them lacking any public health training or background. So to finish, some quick statements. Brazil has already surpassed 13 million confirmed cases, showing that the herd strategy is going on, and 3,000 deaths, and the disease remains uncontrolled. Worldwide, one out of 10 COVID-19 deaths has occurred in Brazil, and today, 1 out of 4. It's missing the 4. But 25% of deaths regarding COVID in the world today is in Brazil. The public system has spent a fortune on treating hospital inpatients, especially on ICUs, threatening the sustainability of the system. Healthcare workers are exhausted, and with the disease disproportionately impacting the most vulnerable, the pandemic has exacerbated Brazil's already sharp social inequalities. Indigenous people, people in prisons, and Black people, and poor people are the ones who are facing the tragedy with much more impact than the other people in our country. So this is what I had in mind to share with you in this first moment of our meeting. And I think now we can, if you wish, make a debate on the theme. Thank you very much for the attention.
Thank you, Professor. I think we can now open for questions, and then I encourage people either to unmute themselves and ask them out loud, or send questions through the chat, and we can read them for you. While we wait for questions, I guess I can state mine. I think there have been many institutional infighting back and forth in Brazil, because the federal government has, for all of the reasons that you mentioned in your presentation, has not been up to combating the pandemic. What do you see any lasting changes that the pandemic will have in how the balance of power in Brazil, how states, municipalities, and the federal government behave in terms of dealing with health problems and more general in politics.
Yes, this is interesting because I think things would be much worse if the National Congress and the Supreme Court in Brazil did not make some efforts to stop this herd immunity strategy that the federal government is putting in place. So we had some legal statutes from the Congress obliging the executive power, the president, to make some good policies, I would say like that. And also the National Congress, the financial aid, for example, the financial aid that made people remain at their houses at the beginning of the pandemic in Brazil, it was put in place by the Congress. The president didn't want it. And he made all efforts to not give any financial aid to anyone in Brazil. But the Congress forced him to do so. And it's funny because he had a big approval after that because he gave the financial aid. But he gave forced by the Congress. But the political benefits from it, he is benefiting now. Also, the Supreme Court. The Supreme Court has been systematically forcing the president and the Ministry of Health to do things, to do a national plan against the pandemic. The Supreme Court obliged the president to do a national plan regarding indigenous people. The Supreme Court stated that municipalities and state members in Brazil, they have the power to legislate and make lockdowns and take health measures in their territories against the national policy. So this was very interesting because the president himself, he went to the Supreme Court to try to avoid states and municipalities to put in place health measures, saying that it's a competence only for the federal government or a legislative competence. And the Supreme Court has told 2 times already that they have this power. States and municipalities have the power to make these health measures. So we have a lot of examples like that. The problem is that while the government is making 1,000 of measures, I told you, they approved more than 3,000 laws, resolutions, and kinds of formal rules regarding COVID. Some of them, the Congress or the Supreme Court are able to block, but most of them keeps going. And the Brazilian society and the Brazilian institutions of control do not have the power and the capacity to avoid it to go on. And so we are in the situation we are now.
Thank you, Professor. I think Lucas has his hand raised for a question.
Thank you, Vitor. Thank you for the very interesting and very informative talk, Professor.
É uma palestra lá em Colômbia que meu professor está dando, meu orientador.
Okay, so my question is, you showed us some very compelling, very factual pieces of evidence, but I'd like to hear more about why we should believe that they're telling us that this is Bolsonaro trying to implement herd immunity and not the fact that Bolsonaro is simply a bad president that understands little or nothing about public health and, well, public policies in general.
Well, thanks for the question, Lucas. Because of the evidences we have. If he was only a bad president who doesn't know anything about pandemics, he would at least listen to his Ministry of Health. But what he did, when the Ministry of Health, Mandetta, the first one in the pandemic, tried to do the right thing, he threw him out. When the second Ministry of Health tried to do the right thing, he threw him out. Also, he had approved laws and resolutions and rules in general, trying to make people believe that you do not have to use mask. You do not have to vaccinate yourself. You do not have to obey your public health authorities. You do have to invade hospitals to see how people is lying regarding hospitals are loaded. So we have, it's not only one or two evidences, and it's not only political speech. This is the most important thing I would have to say to you. I'm not talking only about his political speeches in the journal, in Twitter, in Facebook. No, I'm talking about public policies formally implemented and signed by him. And if we follow these policies, we would be in a very worst way situation now, you know? So this is very, we can highlight a lot of them. So we have, I saw that Vitor shared the bulletin number 10. We have this bulletin in English also. If you think it's interesting to spread to English spoke language the results. But this is, if he was only incompetent, he would only remain silent and delegate to his ministry, do the right thing. You know, I do not want people to die, do the right thing. But no, when the Ministry of Health tell him, we have to do this, he simply fire him, you know, and make laws and decrees, and he vetoes all measures approved by National Congress that could reduce the harm that his public policy is doing to Brazilian people. So this is why I can tell you without any constraints, and I know I'm the right side here. This is a public policy from the federal government. And he fight against governors. He fight against the mayors who are trying to make the right thing. And he put people against them. So he goes to media, he goes to the Supreme Court to avoid governors and mayors to do the right thing. I cannot say this is only an incompetent. He knows what he wants to do, and he wants to do the bad thing. He wants people to die. You can tell me Well, he does not want people to die. He only wants the economy open. And if people die, well, as he told, this happens. Everybody, he told that everybody will die one day. So let's move on. Let's stop being a country of sissies. So when he make a movement like that, he's throwing people to death. In penal literature, this is called that he knows what he's doing, and he's taking the risk of the deaths. At least, if he does not want the deaths, he at least take the risk of it, and he should be responsible of what he's doing. I don't know if I've answered, but I invite you to read the bulletin number 10, where we have a lot of evidences in this sense.
Yeah, I have a quick follow-up question, actually. I'll make sure to read the bulletin. And I think for me, this is the most interesting, at least, part of the discussion. Are you suggesting that in the end, this is a problem of morality of the president, or is this a problem of he tried this strategy, herd immunity, it didn't work, and now he doesn't know what to do, or something else, maybe? I mean, what is the problem? What is wrong with him in the end? Why is he doing this?
Well, this is a big discussion. Some people from mental health here are trying to say that he is a psychopath. So he has mental problems, and that's why he's doing what he's doing. But I don't like this thesis, because I think he knows exactly what he's doing. And this is not fair with people with real mental health. People with real mental health are not usually violent against others, or not usually want to see people dying, So I don't think this is a mental problem. But there are some people in Brazil trying to say he's a sociopath, he is a psychopath, so we have to treat him as someone with mental disorder. The other interpretation we can give is he simply doesn't care about people. He is arming people in Brazil. He opened all kind of controls regarding people having guns for themselves. He has he likes it. I don't know if it's moral. This is not a mental problem. Can be a moral problem, but the thing is, he likes deaths. He enjoy guns. He enjoy war. He likes fight. Before he was a president, he talked. He was a supporter from the military regime in Brazil, and one of his idols was a torturer in Brazil, a military general who tortured a lot of people, and he was his hero. He liked this kind of things. Well, he's like this, and this is not a mental problem. This is his taste. The problem is Brazil has a president like him. I think this is a moral problem. Yes, I think control institutions in Brazil are not working. If Congress works well, he would be already impeached. I think if our general prosecutor was doing well his job, he was already being, he should be already being prosecuted by common crimes because he is throwing people to deaths. But this is not happen because Brazilian democracy is showing its real face. And the real face of Brazilian democracy is that we are a baby democracy. We have not a solid democracy, and we are very open to populist politicians. We are very poor. We have very undereducated people in Brazil. Do not have a good education for democracy, for politics, and so we have a big field for populism and populist politicians to take place, even in the left side or in the right side of politics spectrum. So this is what we are debating here regarding your question.
That's great. Thank you.
So we have a few questions in the chat. In particular, there are two regarding health ministers. So Deborah Martins asks, with the new health minister, do you see chances of changing in the direction of the policy to combat the pandemic? And Camila Braga has a follow-up question to that. She asks, to what extent can different health ministers promote changes in the strategy to combat the virus? For example, if we were to have a competent minister, what would they realistically be able to do?
Yeah, this is what we've been asking to ourselves now in Brazil. We've had a good start. The new minister, he created now finally a national technical committee to take care of the pandemic in the national level. Yesterday, the president went to TV to talk in a positive way about vaccines. So I think he has been suffering a big pressure to change his herd immunity strategy because even in the international arena or national arena, the control institutions are beginning to circle him. So I think we are going to have some changes, but Bolsonaro is Bolsonaro. And we never know if this is only a game for now, and he will come back to what he is in a month or two, or if he's going to really give a change in his policy with his new minister in order to put in place a correct national policy regarding the control of the pandemic in our country. So we are looking now in a positive way because some changes have been made in this beginning, but we have to see because the second minister, Nelson Teich, he was the same thing. He began doing the right things, but he didn't last 1 month in the Ministry of Health. So we have to see if this new minister beginning to do the right things is going to remain there. So only time will show us what is going to happen and if Bolsonaro has really changed. What has changed is that the political scenario and the economic scenario, even the most rich people in Brazil are seeing that things the way are going will put Brazil in the misery, even for the rich people, and bring them to death eventually. So even the most rich people in Brazil are beginning to pressure the government to ameliorate its policy. So maybe things are going to change. I will be optimistic here, but with a parenthesis that the history shows us that Bolsonaro is Bolsonaro and he can changes at any time.
There is, so we're already running a little bit late. I will read another question from the chat and compliment, but ask that for urgent questions that we're running out of time, so be mindful of that. But Lidiane asks you to tell us your impressions about last night's speech that the president gave in national television, considering the pressure of economic agents. And I would also like to compliment, asking to what extent is his strategy mostly the discourse, and to what extent is he changing tactics in the way he's dealing with the pandemic, and how does that translate to action? So I think, for example, even though vaccinations are very slow in Brazil, if you consider Brazil and Mexico and Chile, for example, we have 85% of all of the vaccine doses delivered in Latin America. So how to account for speech and discourse from the president and some of the relatively not so negative aspects of combating the pandemic?
Well, this is a very interesting questions. Thanks. I think we are facing now a change, actually, as I was talking. Last night's speech from the president was a turning point, and we saw he was under pressure. He was, usually he is very informal, he make jokes, and he was straight to the point. He read the speech someone have written to him, and he kept in the script. So this is new for him. So the speech is different. The way he's behaving himself is different. He appeared in this week with mask, thing he didn't do, but how is it going to be transformed in real policy or real rules? We will have to see. Some changes we've been seeing. The federal government have signed finally new contracts to buy vaccines from Pfizer, from India, Covaxin, and he is searching abroad for oxygen. He is searching abroad. There is one thing in Brazil happening is terrible. We are lacking sedatives to intubate people. So people are being intubated without sedatives. This is really a pain. And now we've seen our international ministry going to search oxygen, sedatives, syringes, vaccines, finally, after 1 year. So is it late? It is late, but it's a change, Vitor, that we've been seeing. And I hope this is a wave that keeps in this track. But we have to see, as I told, Bolsonaro is very uncertain. And at any time he can change again if he feels that he must go in any other way. He can throw out his new minister and he can go back to what he was at any time. Well, but I do not trust him anymore because of what I've seen he doing formally by laws and policies. But let's give him and his new minister a time of um, to see if they will change really or not.
Maybe we have time for one more question and we can wrap up after that.
Yeah.
So Antonio Guimarães asks about new virus variants from Manaus that could put pressure in Brazil, international pressure in particular. And you also mentioned that there were already measures internationally to pressure the government to change path in terms of how it's dealing with the pandemic. Maybe you could close with remarks about that.
Yeah, thanks for the question. Yes, this variant has been a beginning for a big international pressure. The first one was Brazilians are not accepted anymore in any country except Mexico, I think Cuba, and a few more, mostly touristic countries. Brazilians are not accepted at all. So if you want to go even to work, you have to pass through a via sacra to achieve the new country. So this is being a pressure to the high economic levels in Brazil, and with that they are pressuring the president. Also, it's important to say that the World Health Organization is starting to pressure a lot Brazil, because you talked about the variant from Manaus, but yesterday the Oswaldo Cruz Foundation in Brazil has turned public that they have found at least 7 new variants in Brazil with different levels of lethality or transmissibility, and we have to understand better. And also the problem that with these variants, we don't know if the vaccines we have will help for these new variants. And this could be a global problem because it's very hard to keep these variants in Brazilian territory. So we've been receiving a big pressure, especially from the World Health Organization. The general director and the technical staff, they've been pressuring Brazilian staff a lot to control the pandemics and do the right things here. But we know that in Brazil, the Brazilian government, they do not believe in international organisms. They are very alike Donald Trump in this. They do not believe in globalism, in World Health Organization, and we don't know yet if this kind of pressure will work. What we believe is that now the economic pressure will work. Once Brazilians are not accepted in any country anymore, once this is going to bring problems to commerce, international commerce from Brazil. This will begin to make an internal pressure to force the president to change his moves. But this we will have to see. because again, Bolsonaro is very uncertain about who he's going to be tomorrow and what he's going to do tomorrow. So today he is embracing the good discourse and the good policies, but we don't know if in 2 months, 3 months, this will remain. So let's wait to see.
So yes, in terms of economic sanctions, this reminds me of the article you contributed to the bulletin regarding the internal sanctions in terms of mandatory vaccination in Brazil in COVID, which was recently upheld by the Supreme Court, and encourage people to go and read. Thank you, Professor Aith, for joining us today. I am sending in the chat a link for our newsletter for those of you who are not registered yet and who would like to hear more from us, including for the recordings of this meeting. And thank you, Professor, once again for joining us and for sharing your research.
Thank you for the invitation, and hope we can continue this talk in the future. Bye-bye.